Welcome to the module Urinary Tract Infection Prevention and Recognition, a Frontline Forces training presented by Superior Health Quality Alliance or Superior Health. This second session will address the prevention of urinary tract infections. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. So, direct caregivers play a very critical role in providing care to individuals in many settings of care. The purpose of this course is to further your learning and build on your current knowledge about urinary tract infections. What you know and how you use that information improves the quality and safety of the patients you care for. You are viewing the second module of the series, which provides information on the prevention of urinary tract infections. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. Once you've completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. After completing this module, you should be able to list causes of urinary tract infections, describe strategies to prevent UTIs, and describe strategies to prevent catheter-associated urinary tract infections. Urinary tract infections can be caused by many different factors. Some of the common causes for people living in nursing homes or assisted living facilities are chronic diseases, fecal contamination, functional impairment, invasive devices, and dehydration. People with chronic diseases such as diabetes, heart disease, and kidney disease lower a person's ability to fight infections. Those with Alzheimer's, Parkinson's, or cerebrovascular diseases may have a complication called neurogenic bladder, which affect the nerves and muscles controlling the bladder and puts them at higher risk for a UTI. People with incontinence are at high risk for UTIs because they are at higher risk of bacteria entering their urinary tract. Bacteria entering through the urethra is the primary cause of UTIs at any age. E. coli bacteria causes 85% of all UTIs. E. coli appears naturally in the gastrointestinal tract, so poor hygiene surrounding bowel movements is a major cause of UTIs. Older adults who wear incontinence products are at an increased risk for exposing their urethra to E. coli, particularly if they are wearing the wrong products or if the products are not changed frequently enough. Soiled incontinence products, when left on too long, can introduce harmful bacteria into the urinary tract. People with functional impairment, including decreased mobility, are at a higher risk for UTIs as they are more likely to have incomplete bladder emptying after voiding. Invasive devices, such as urinary catheters, allow bacteria and viruses to enter the body. Twisted urinary catheter tubing prevents urine flow into the collection bag. Dehydration also puts persons at risk for developing a UTI. Drinking flushes out the urinary system, which is important to rid the body of toxins. Bacteria builds up when there is a minimum urination or drinking of water. Since people with chronic diseases are particularly susceptible to UTIs, it is especially important that you adhere to infection prevention standard precautions when caring for people with chronic diseases, especially hand hygiene. On average, healthcare providers clean their hands less than half of the times that they should. For almost every common germ, including E. coli, that is often causes UTIs, alcohol-based hand rubs have been found to be much more effective than plain or antimicrobial soap for hand disinfection. The CDC provides these guidelines to determine when healthcare workers should complete hand hygiene: immediately before touching a patient, before performing an aseptic task such as placing an indwelling device or handling invasive medical devices, before moving from work on a soiled body site to a clean body site on the same patient, after touching a patient or the patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, and immediately after gloves are removed. When caring for people that are incontinent of urine or feces, to prevent a UTI caused by incontinence, it is important to prevent fecal soiling by offering regular opportunities for toileting. It's important to regularly check for soiling when caring for people who are incontinent, and to encourage frequent bladder emptying by helping with and/or providing toileting opportunities. To prevent infection, it is also important to provide proper perineal care by following these steps. Wash and dry your hands before you start. Put on gloves. Explain to the patient what you will be doing. Spread the patient's legs to reach the area. Prepare a soft, warm washcloth. Clean the region from front to back. Dry the region with a clean cloth. Apply a cleansing lotion when necessary. Dispose of your gloves, and wash and dry your hands. As with people who are incontinent of bowel and/or bladder, for those that are impaired and need assistance with toileting, provide regular opportunities for patients to empty their bladder and assist them as needed. A person with a Foley catheter is at high risk for developing a UTI. To help with UTI prevention, be sure to keep the catheter and collecting tube free from kinking. Always keep the collecting bag below the level of the bladder. Do not rest the bag on the floor. And empty the collecting bag regularly, using a separate clean collecting container for each patient. Avoid splashing and prevent contact of the drainage spigot with the non-sterile collecting container. Other strategies to prevent UTIs for a person with a Foley catheter include using standard precautions that includes the use of gloves and gown as appropriate during any manipulation of the catheter or collecting system, and providing routine hygiene that includes cleansing around the area where the urine is discharged during daily bathing or showering. All of these steps will decrease the likelihood for bacteria to enter the urinary tract through the Foley catheter, thus preventing a possible UTI. People who do not have easy access to water, do not remember to drink regularly, and/or are unable to drink independently are at risk for dehydration. Most likely, this includes most of the people you care for. So, to help prevent dehydration, as well as a urinary tract infection, serve water with every meal, replace water pitchers every 24 hours, and replenish every shift and as needed, and provide structured drink rounds throughout the day. A study completed in January of 2021 showed success in reducing UTIs in nursing homes when direct care staff focused on hydration, hygiene, and catheter management. This shows that as a direct care worker, your decisions make a big impact in the prevention of urinary tract infections. Congratulations, you have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Urinary Tract Infection Prevention and Recognition Prevention of Urinary Tract Infections quiz on the Frontline Forces webpage or in the YouTube description below.